Hello, my name is Kylie. I'll be your nurse today. We'll be performing a simple head-to-toe assessment that should take no longer than 15 minutes. Can you give me your name and date of birth, please?
Molly Bima, 11/01/04.
Okay, awesome. Do you know where you are?
The hospital.
Do you know why you're here?
Checkup.
And then do you know the month and the year?
February 2025.
Patient is ANO times 4. Do you have any allergies?
No.
And on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain in your life, what do you rate your pain right now?
0, no pain.
Okay, so if the patient did have any pain, I would then assess it further with the PQRST model. The patient's facial expression is pleasant. They're showing no signs of acute distress. Their mood is good. There's no obvious abnormalities, and the patient is sitting erect. And then next, I'll be checking skin and nails. The nails are smooth and rounded. There's no signs of obvious clubbing. Capillary refill is less than 2 seconds. Skin temperature is warm and dry, and skin color is appropriate for ethnicity. And then I'm also going to check your skin turgor. Skin turgor is good. There's no obvious signs of tenting. So now I'll be doing your neurological exam for your eyes. Okay, can you look at the pen for me and look at the wall, then back of the pen, and then follow the pen with just your eyes. All right, pupils are equal, round, reactive, and accommodating to light. Can you hear this?
Yes. Yes.
All right, and then so patient's hearing is normal, and patient's speech is also normal. She's been talking to me this whole time. Next, I'm going to assess your nose, mouth, and throat. I'm gonna look for any nasal drainage. No nasal drainage, good. And then can you plug one nostril for me, please, and breathe? Good, and then do the other one. Okay, awesome. Nasal patency is normal, breathing is smooth. Next, looking at the mucosa. Good, okay. Mouth is moist, pink. Gums are intact, teeth are white. Lips are not dry and cracking, and skin color is pink and normal and appropriate for ethnicity. And then looking at the neck, the trachea is midline. Next, for the respiratory part, I would usually have the patient take off their shirt to assess their chest for any abnormalities, but we're not doing that today. But there are no obvious signs of abnormalities. And then now I'm going to be listening to your lung sounds. Just breathe in for me every time I move my stethoscope. All right, I'm gonna have you turn around that way for me. And lateral. Okay. Lung sounds are normal and clear. There's no extra sounds, and the patient is breathing unlaborably, and they're not using any accessory muscle use. Next, I'll be listening to your heart sounds. So, listening to the aortic valve, the pulmonic valve, Erb's point, the tricuspid valve, and the mitral valve. And usually this is where I would take the apical pulse for 1 whole minute, but we are not doing that today. Now I'm going to take your radial pulses. All right, radial pulse is equal and 2+. Pedal pulse, equal and 2+. Next, I'm gonna have you lay down for me, please. Normally I ask the patient to lift up their shirt for the abdominal exam, but we're not doing that today. There's no obvious signs of abnormalities. The abdomen looks flat. Are you in any pain?
No.
When was your last bowel movement?
This morning.
And when was your last urination?
2 hours ago.
Okay, so that's all good. Next, I'm gonna listen to their bowel sounds. Okay, bowel sounds are normal and active, and the abdomen is smooth. Next, I'm gonna have you sit up, please. And then can you get up and take 5 steps that way, and then 5 steps back towards me? Okay, awesome. Patient's gait is normal. There's no trouble walking, and the posture stays erect. Next, I'm gonna have you squeeze my hands. All right, upper extremity strength is equal and strong. And then push down my feet. Lower extremity strength is equal and strong. And then I think that is gonna be all. Usually if you were in a hospital, I would lay the bed down to the lowest level and lock it in place, put the 2 side rails up, have the call light in reach and anything else in reach, and then I ask the patient if they needed anything else or had any questions. Do you need anything else from me?
Nope.
Nope. Okay, awesome. And hand hygiene. And we're done.
Hello.
Hi.
Hi, my name's Morgan. I'm going to be your nurse today.
You're saying
Going
to
to get some
yourself,
hand sanitizer.
about
Love. Can you tell me what your name is?
My name is Hannah.
that's the
Hi,
question.
Hannah. And can you verify your date of birth?
'Is the valve
8/16/2000.
open
All
and
right.
closing?
And
if
can you tell me
hear-
why you're here today?
Just a normal
They
check-in.
are. But
Wonderful.
if you hear a swoosh or a
All right,
click,
so what we're going to do
they're
today
not.
is an assessment. I am going to start with some vital signs. I know you said you're here for a checkup. Anything abnormal I should know about? Any pain?
That's what you're listening for. You're not listening for
I've been
like,
having some pain
oh my
in
God,
my
how do you
wrist.
capture a
Okay,
sound?
I play tennis
What you're trying
and
to
it
decide,
just sometimes
oh,
it
my
hurts.
valves-
Okay. When it's the worst, what would you say it hurts on a scale of 1 to 10?
And what do you know
Like
about that?
an 8.
An 8? Okay, does anything make that worse?
Really just tennis.
Tennis? Anything make it better?
Icing it.
Icing it? Okay. And how do you describe the pain in general?
It's just kind of like a throb.
Throb. Okay, and then ice helps the throbbing.
Yeah.
All right, good to know. Check it out. I'm gonna go ahead and start your vitals. Okay.
And that's the rhythm of our song, but our song is off. It is off beat. What do we call that?
I get a temperature.
When your song is not songing.
98.1.
So you are listening
Perfect.
with the open and the
Go ahead
closure
and just stick this on your finger while you pocket your cuff on.
of the valves. Because what valves do we have in the heart? All right, can you see where they're at in your head? Can you find the valves? Okay, you're making sure those work. Can it kill you if your valves don't open and shut? Yes. Can you get warm without valves?
And
Do
relax
infants have an
there.
issue where sometimes their valves don't close? Do they get surgery for it? Foraminal volley. Some say oval. I should hear oval. Okay, very common. People live, it doesn't reduce lifespan. It's just kind of like an anterior fontanelle. That's soft water, kind of the same thing, right? As long as you watch it and there's nothing abnormal going on with it, it pretty much will go away, or you can do surgery to fix it, and then it's perfectly fine.
A lot of these athletes that are dying, they're like have heart abnormalities that were actually found.
Yeah.
118/72. Is that pretty normal for you?
Yeah.
Wonderful. And you have your oxygen saturation at 98%.
It would surprise me if kids had to start echoing before going into life. Because you're gonna expend yourself. I mean, we ran 5 miles before. Every day to college. Every day. So
Go
we got
ahead and
Sunday
just
off.
fill your
That's
wrist.
a lot.
I'm doing is taking a pulse.
It's interesting because people think that it's not super common, but it is. Yeah. It's a common, like it's not, it's bad to say it's a common thing, but it's a known thing that we've had to worry about for years.
Yeah.
And then when it happens to LeBron James down there, like, oh, maybe we should.
Maybe we should, yeah.
Yeah.
Gotcha, 72,
Yeah,
that's perfect.
Like,
While I was doing that, I was also kind of just looking at your breathing. It looks pretty normal to me, not labored, about 16 breaths per minute, which is just on par. I'm gonna clear some of this stuff out. Okay.
because we have family genetic disorders, so I've had to have myself and all my kids.
A couple of questions for you, Miss Hannah.
It's a cardiomyopathy that starts in early.
It's not a quiz, I promise, but can you tell me who the president is right now? Okay, perfect. And if you found a piece of mail on the ground, what would you do with it?
I put it in a mailbox.
Okay, perfect. And then what is today's date?
It is
Mixed martial arts,
the
jujitsu.
12th, the 13th of March.
So close. It is the 14th.
14th of March.
What year is it?
It is 2025.
Perfect. Okay.
Yeah,
And if you just look towards me or look straight ahead, behind this curtain here.
Qualify yearly. And he's made his second year on Team USA, so yeah, he gets to wear all the clothes.
They get all the nice
All
Yeah.
round reactive to
Yeah, he likes to
light.
send me pictures like, look what I just got in the mail, Mom.
And I'm just gonna go ahead and feel just make sure everything is nice and symmetrical. Any tenderness or wounds or anything that I should know about?
No.
Okay, pretty normal cephalic. Just feeling your lymph nodes. Any tenderness or anything when you swallow?
No.
Go ahead and say ah for me. Everything looks pink and moist, no redness, no drainage of your nose or anything like that. All right. I'm gonna go ahead and I felt your pulses already, but I'm just gonna go. Any tenderness down here?
No.
Okay, cool pulse down there. Any tingling, numbness, anything like that? Okay. All right. Getting around the better over. All right, go ahead and squeeze my fingers. I'm gonna push your hands down, try to resist it. Okay. You do the same to your feet. Resist that. Okay. All right. And then I was kind of feeling your skin. Everything feels warm. Your skin looks great to me. Perfect color. No sweating or anything like that. Sugar looks good. Your fingernails. While I'm pressing down on your fingernails, I'm just checking to make sure that the color is good and that the capillary refill is what it's called. It's less than 2 seconds. It refills and you're good to go.
Their arm down, make sure they don't pull up their
Okay, do you want to try? Sorry. We upload it.
And now that I have your vitals, I'm going to go ahead and just listen to your vitals. Okay.
That's it, that's all I'm grading this semester.
And if it's something we completely fuck up, do we get to do it again? Or are you just gonna give us feedback?
You do, I'll probably just give you feedback. At this point, you shouldn't be doing that.
Okay. Well, I'm just saying, like,
Because
hypothetically.
you should be catching each other at this point.
Let's lie down and listen to your bowels while I have the stethoscope.
Do what?
Okay.
Oh, you got Hannah's. That's air drop for you.
Miss Hannah, will you sit up for me?
Yes.
I'm going to listen to your lungs.
So, yeah, so
You
now
can
this
just
is
breathe
sort of
normally.
rubber meets the road, right? So, what you're listening, when I come to talk to you guys, I'm gonna be asking you direct questions like, why do we put our scope to their chest? What are we really listening for? And people go, oh, murmur. But do you really know what a murmur is?
I'm just coming
Well,
around
you
here
do,
like that.
because a murmur is when a valve is not opening and shutting at the rate that it should, or as much as it should, right? So, you know that you're not only listening for holes in the heart, if you will, but you're also listening for the pattern that it's making.
Thank you.
And then the rate.
Couple of questions for you. So I didn't hear anything abnormal. Your breath
Well,
sounds
is this
clear.
heart
Your
rate
heart sounds like it's a normal
falling
rhythm. No
between 80 and
murmurs.
100?
Do you have any concerns with breathing, coughing, anything like that?
No. Heart rate?
No? Okay,
But
perfect.
still have a normal.
How about with your bowel
You
movements?
can, what do you call that?
All normal there?
All normal.
Okay, when was your last bowel movement?
Science. So
last
science
night.
is the big
Last
one.
night? Okay, and everything was good to go? Okay.
As far as I know.
Perfect, I just wanted to make sure. Okay, wonderful. Your bowel sounds sounded what we call active, so good to go there. Wonderful. And as far as urinating, anything abnormal there? Any burning? Any abnormal odors, color?
So it's making your complex.
Wonderful.
So you're gonna have
Alright.
the P wave, the QRS, and your T. Because isn't that what we want to know?
Right,
Because
and
when
then
you have that PQRS,
I am
and
going
it looks
to-
beautiful, what does that tell you? When you see that beautiful PQRS,
are you able just to
that's got
come to the
right
side of the
little drop,
bed?
got the right little drop down, peak at the R, comes down.
And then
at the
I will go
S,
ahead and help you up. And then if you could just take a couple steps forward.
And that your atria.
And then a couple steps
and
this
your
way.
visual firing.
Okay, any dizziness?
No.
That's
Okay,
it.
you can go ahead and have a seat back on the bed.
So if you walk up to a strip and you see that, can you rest easy?
Perfect.
Yes, right now. Because you've got the components of a good heartbeat. Your atria and
Do you have any
your
questions for
ventricle
me?
are firing.
No?
So I
Okay.
don't even freak out.
All right,
when
well,
I'm
thank you
walking
so
by.
much. I'm going to go check on the orders, make sure that we don't have
You know,
anything else to do
QRS is
today.
that maybe
And then I'll be back in about
the
10
heart's
minutes or
not firing.
so.
Okay.
Okay.
Thank
But
you.
if they are, I don't really get, there might be some PVCs and there might be a block every now and then. But for the most part,